G'day, I'm Caleb and I'm going to take you through CPR and choking on an infant. An infant is less than 1 year of age. Choking is one of the most common reasons why an infant might have a cardiac arrest, hence why we are demonstrating this scenario. So I want you to have a go at this scenario. We call all of our infants Little Johnny. So let's say we're feeding Little Johnny. He's 7 months old. We're feeding him and he's going okay. Then we turn our head, we're giving him grapes. We turn our head and we hear some coughing. We turn around and we have a look. Little Johnny is coughing. He's coughing a lot. He is choking, but if he's able to cough, he's able to get air in. He's trying to clear the obstruction himself. So we just want to encourage coughing. We don't want to go and scare Little Johnny, hit him on the back if we don't need to, because if we hit him on the back and scare him, he may go like that and it might become a full obstruction. So we just want to sit him forward and monitor him. Now usually they will clear it quite quickly, within 10 seconds. Let's say it's been at least 20 seconds now and we're starting to get a bit more concerned. Now we might get on the phone, call 000 and let them know that they're having a partial airway obstruction. On the phone, we're talking to the ambulance, telling them where we are, and now we notice that Little Johnny is no longer able to cough and he's starting to change colour. Now we need to take Little Johnny out of the high chair and we need to deliver some back blows. We're not going to go and stick our fingers down Little Johnny's throat because we're just going to cause a lot of airway trauma. So to do back blows, we're going to have Little Johnny face away from us. We're going to use our non-dominant arm and put it through Little Johnny's legs and hold the chin. The reason you're holding the chin is because the head is like a weight in an infant. It's the heaviest part of their body. Now we're going to aim Little Johnny down. We're going to give Little Johnny a back blow in between his shoulder blades. His shoulder blades are reflected as two circles on his back here. Now, right in the middle is where we're going to hit him, and we're going to use the palm of our hand and we're going to do it in a downwards motion. So it will look something like this. One back blow, and we're going to check to see if it's cleared. If it hasn't, we may go a little bit harder now. Second back blow and see if it's cleared. Still hasn't, third back blow, see if it's cleared. Fourth back blow, see if it's cleared. Fifth back blow, see if it's cleared. Now, usually that is very effective. Let's say that it hasn't been effective in this instance. We would now, still holding Little Johnny's head, turn him over, still aiming him down as much as we can. We would give what's known as chest thrusts. Chest thrusts are similar to compressions, they're just sharper and deeper. So we're going to push down like this and have a look to see if it's cleared. And have a look to see if it's cleared. 3, have a look to see if it's cleared. 4, have a look to see if it's cleared. 5, have a look to see if it's cleared. All back blows and chest thrusts are doing is generating pressure below the obstruction in the hope that it comes out. If Little Johnny is still rigid and tense, it means that they are still conscious. If they are still conscious, I'm now going to alternate. Back blow, chest thrust. Back blow, chest thrust. Back blow, chest thrust. And just keep doing that until Little Johnny goes unconscious on us. How do I know he's gone unconscious? Common used term is that they go floppy on you, so that they go very relaxed. If that happens, I now need to start CPR. If I'm going to start CPR on Little Johnny, I want to use a bench. That would be the ideal situation. If I'm going to use a bench, I'm not going to just put Little Johnny on the bench like that. You try and breathe with your head like that. And that's what you're doing to Little Johnny, because the backs of infants' heads are so big that that's what actually happens. They're not in a neutral position. We need to put them in a neutral position, and that's by putting about 4 centimeters of padding underneath their shoulders. That props them up in a neutral position. Now that they're in a neutral position, I can go through giving CPR. Now, CPR is commonly taught to use 2 fingers. Now, I prefer 2 thumbs. So to use 2 thumbs, hands on the side of the chest, use your thumbs, and I can go for a lot longer using my 2 thumbs. My compressions to breaths is still 30 compressions, 2 breaths. 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now to give the breath, I'm not going to do a head tilt. Think of a straw and bend that straw. That's what a head tilt does. It kinks off their airway. They've got a shorter trachea or airway windpipe than us, and it's not as strong. So it's important not to do an aggressive head tilt. What you actually want to do is bring their head forward in what's known as the sniffing position. And to remember that, what your head does if you went to smell something, that's the positioning you want to put their head in, so up forward. And then you want to give your breath. Now up to the age of 6 months, they're predominantly nasal breathers. So we want to cover the mouth and the nose when we go and give them their breath. So head forward, covering the mouth and the nose. 1, 2, and when you give them their breath, fill your cheeks. And that's how much breath you give them. They hold about 250 mil of air in their lungs, whereas you hold a lot more, about 6 litres in yours. So there is a big difference there. So it's very important that you follow the steps of just only giving what's in your cheeks and covering the mouth and the nose. You're probably wondering, why do we still give breaths? They were just choking on something. Why am I giving breath? Now, most likely what's going to happen if somebody was choking is whatever they were choking on is actually going to stay lodged wherever it was. When you go and give your breath, air is going to rush past that obstruction and go and inflate their lungs. And they need oxygen. They're depleted of oxygen. They're hypoxic. If that doesn't happen, if you actually push it down further, whatever they've been choking on, then if you did give your breath and you pushed it down further, with your anatomy, your right bronchus is straighter than your left, and it's larger. So you're actually going to push it down into their right lung, which means now they should have their left lung to breathe with. One lung is better than no lungs when it's lodged up here. So you are still going to give breaths to somebody, even if you are unable to remove that obstruction. You may ask, what happens at hospital then with that person? Well, they get put to sleep, and a surgeon will go and do a bronchoscopy and remove that object. In regards to using the defibrillator for infants, it's less likely to be required. You can still put it on if you like, if you've got child pads, but it is less likely to be needed. More than likely, it's going to say no shock advised. Infants and small kids usually go into cardiac arrest, and they go into non-shockable rhythms or asystole, which is flatline. The basics of CPR and breaths is the mainstay and is a high priority over your defibrillator, generally speaking, when they're younger. I hope that clears up a few things.